Hello! This time I would like to discuss the question whether there is bone resorption under the pontics of resin-bonded fixed dental prosthesis and whether implants can prevent bone resorption. Here you see on the left side a clinical case where the patient received a resin-bonded fixed dental prosthesis in 2004. On the right side you see the same restoration 16 years later. You see a little bit of abrasion of the central incisor, which is a abutment tooth, but you do not see any clinical relevant soft tissue alteration, and you also see no gap between the pontic and the soft tissue, which would occur if there would be some resorption. So obviously, so-called inactivity atrophy doesn't take place. Why is that the case? I think that is easy to explain. That is because every time the patient is chewing and loading the abutment tooth, that means the central incisor, also the lateral incisor moves with the abutment tooth, and by this little mobility of the pontic, the soft tissue gets a certain massage effect. And this massage obviously is enough to prevent any resorption. There is a certain loading, but it's not an overloading. That cannot be compared with overloading under removable dental prosthesis. There we really see bone and soft tissue resorption. There's also scientific data from the University of Zurich which showed that we do not have clinically relevant soft tissue resorption under the pontics of resin-bonded fixed dental prosthesis, and also not under the pontics of conventional dental prosthesis, fixed dental prosthesis, when an ovate pontic is adequately inserted. So, how about implants? Do implants really prevent bone resorption, especially in patients with congenitally missing teeth? That is not really the case, because we know from scientific data that over 10 years, even around healthy implants, you have a certain loss of soft tissue and also bone that is around 1 millimeter within 10 years. So this is just physiological loss of bone. And of course, this millimeter is a mean. Some patients have less, some patients have a little bit more of bone resorption around healthy implants. But then, what happens if the patient gets peri-implantitis? And 1 of 5 patients will get a peri-implantitis, so an inflammation around the implant within 10 years. Then, of course, a lot of bone is resorbed and the damage for the patient is severe. So to summarize, resin-bonded fixed dental prosthesis will prevent bone resorption when they are designed correctly, and implants are not really better. They even present a certain risk to get peri-implantitis, and then, so 20%, 1 of 5 patients will have a severe problem later on, especially in the aesthetic zone. I hope this explanation was helpful, and I hope to see you back soon. Bye.